No shame. No diagnosis is too taboo to discuss.
Okay, the beginning, I had a small, what I thought was a cyst. I thought it was a Barcelona cyst, and I thought it was going to burst on its own. Um, but that wasn't the case. That didn't happen. And over a period of time, it became larger, but I wasn't focused on it. And I guess I really wasn't focused on it was because of me not being sexually active. And so by the time I got to the doctors, the GYN, I was referred to an oncology GYN. And she did a biopsy, and the biopsy came that it was cancer. And I had a smell as time went on, and I was trying to use over the counter products, and they had an applicator, and the applicator is very small, but I could not get the applicator to enter into my vagina. But when I tried to use it, I would cause like slight bleeding, so I knew something definitely was wrong. And by the time I paid any attention, it was too late. It was cancerous, and the size of it, it was labeled a stage 2, and I could not have operation. It was too close to my urethra, and they did not want to chance anything happening during surgery that my urethra may become compromised or something like that, injured or however they put it. They just did not want to do that. It was too much of a risk. And so that's how I ended up having chemo and radiation at the same time with this tumor for it to shrink. And that's vulvar cancer is what it's called. Because I really didn't pay attention to it, really wasn't even focused on that area. It's just like you're focused on your labia or just the entrance into your vagina, and that's it. It wasn't that high up, but the way it was positioned and the size of it brought it close to my urethra. Yes, if you touched it from the inside, if you stuck your finger on the inside, once it became that big, it was tender to the touch. So going to get an exam wasn't happening. I was like, you can look, but you just can't touch it because it was quite painful by that particular time to touch it. But from the outside, if you ran your finger on the outside of my vagina area, you could feel it a little bit. No, didn't hurt when I urinated. I have a menstrual cycle because I've had a hysterectomy in 2013. I just turned 60. So those hot flashes do come, every now and then. I noticed first was an odor. That's what I noticed. Like this odor came, and I'm trying to use over the counter products, and I couldn't use them properly. So the first time I tried to use the applicator with the tablet that dissolves, I could not put it in. So I just took it off the applicator and tried to shove it up there, but it wouldn't go in because of the tumor that was protruding from the left. So I put it in so it was kind of sideways, which was quite uncomfortable. So I just laid down in the bed and just let it dissolve. But the second time I tried it, I just couldn't do it. I couldn't do it at all. So I just said I need to make an appointment with the doctor because the smell would go away for maybe a day or two, and then it would come right back. To me, it felt like a round, small marble. Not a small marble, but bigger than a small marble. maybe like in between a marble and uh, a jack ball. If you remember back in the day, we used to play jacks with the ball.
Yeah.
Right. So maybe a small jack ball, in between a small jack ball and a large marble. That's how it felt to me when I would feel it.
Yes, there's something there, but it was really the smell that caused you to be concerned, correct?
Correct.
Why?
Yes.
Why was the smell more concerning to you than the fact that you felt this marble size thing in your vulva area?
Because the thing, if I, because I didn't insert anything or anything like that, I wasn't having sex. So I couldn't tell if it was really, really painful or if it was a blockage until the smell came. So when the smell came, it was just such a horrific smell to me. And, that it just didn't smell ordinary. So I'm thinking, all right, maybe it's BV. Maybe I have BV. So that's the
Mhm.
products I was trying to use, but it only stayed away for a day or two. But it was just seemed like it was getting worse than the smell of BV.
Was there also a discharge, a vaginal discharge?
No, I didn't have a discharge.
Did you feel as though it was getting larger?
Once it was well, the once I felt that it was quite large, and with the smell altogether, I don't know if it would have got larger, but I went to the doctors, and of course, that's where they stopped it. But it was quite large because they didn't want to operate. They didn't want to remove it. They thought the safer way would be radiation and chemo.
You make an appointment to see the GYN. You're not thinking this could be cancer.
No, I'm actually still thinking this is somewhere in the Bartholone cyst family. That's what I'm thinking,
Okay.
and that was my thought. So when I got to the GYN, I told her, you're not going to be able to insert anything to see. You're going to have to use your finger to feel it and look at it that way. And she did. And so she said, I'm going to refer you to a different gynecologist. And it was oncology GYN. So I'm thinking they just want to make sure that the cyst, because I kept still calling it a cyst at that particular time, wasn't cancer. That's what my thought was.
Okay, so
That's
at
why.
this point, you're thinking this is not cancer.
Right. Yeah. But they just want to be sure that
Okay.
it's not. Yeah. I wasn't in denial. I wasn't concerned because my brain was still thinking Bartholone cyst family, and that would not be cancers. That was my thought process.
Okay.
And so that's the reason why I didn't think about cancer at all.
Okay, so you go to the GYN oncologist thinking they're going to confirm that it's not cancer,
Right. Yeah.
and they look at you, and what do they tell you?
That they needed to do a biopsy.
Okay.
And we scheduled a biopsy, and they put me under anesthesia to get the biopsy done. And a few days later, I looked on my chart and I'm reading, everything that was the procedure. And then I see cancer. And I'm going, no, that can't be cancer. And I'm going, wow. I read the report before they called me. Yeah,
Okay.
that's what I did. And because they did end up calling me. But with the portal, it was available. So I just started reading it. And I think maybe the next day, because I read it at night later on in that evening. And the next day they had called the GYN oncologist called and told me, what the results were. And I was like, okay. And I was like, so what do we do from, here on out? What I was told was that it was cancer, the tumor was cancer, and it was a cancer caused from HPV. And that part I couldn't understand because I haven't had sex in almost 10 years. So how could I have a tumor that was caused by HPV? And they didn't have an answer for that. And that's just like a mystery question, an unsolved mystery question, I can say. Um, but they said since the tumor was so large that I couldn't have surgery, I would have to get chemo and radiation. Now, they said I could do it two ways. I could have chemo radiation to a certain point to where the tumor is small enough for them to operate, or just continue with chemo radiation and just let it take the tumor completely out. They said it was like 3.2 centimeters by, I forget, by maybe 2.2 or 1.2. That in the way it was positioned, it
Okay.
was positioned too close to my urethra.
Okay.
My the first day that I had chemo and radiation, the very first day, the very first treatment, I experienced nausea like I've never experienced it before. It was just bad. Matter of fact, I woke up out of my sleep and I was just sick. Like, oh my goodness, I'm going to throw up. But I didn't throw up. I just had the spits. Like, you just keep spitting. And that's what I kept doing. And I was just like, oh my goodness, I've never felt this bad before, and I couldn't seem to get it together. And I remembered I had some ginger candy. Someone gave me some ginger candy, and I ate a piece of that, and I went back to sleep, and I was fine. But I still woke up the next morning kind of with a slight nausea. But that's the side effects to chemo and radiation is nausea. So I was nauseous from that. Even though they give you anti-nausea medicine during your chemo treatment, and they also gave me pills to take that I would have to take around the clock to keep the nausea down. So I was taking pills every 4 hours. And I had to eat. If I did not eat, I would still feel even worse. So I had to force myself to eat because, when you're nauseous, you don't want to see food, you don't want to smell it, you don't want to think about it. And that was me. I just didn't, but I made myself eat anyway. And then after a period of time, they gave me Ativan to help with my nausea. And that was more, to me, that made me sleep a lot. And so I wouldn't take the Ativan all the time because I didn't want to sleep all the time. So I was working at the time of my diagnosis.
Were you able to continue to work
Well,
once?
I stopped working the the week before my first treatment. So I stopped working maybe like on that Thursday, and because that following Monday would be my first treatment. So I stopped. But at first I wanted to work for the first 2 weeks because I was told the first 2 weeks you'll be fine. You should be able to get through. But I'm glad that I did stop working during the initial treatment because that nausea, I wouldn't have went to work the next day. That Tuesday, the following day, I wouldn't have went to work because when I woke up, I still felt some nausea, but nowhere near where I just had the spits like I did the previous night. I started, my first treatment was March 3rd, and my last treatment of chemo was the 23rd of April, and the last treatment of radiation was the 24th of April. Schedule looked like chemo was once a week on a Monday, and radiation was Monday through Friday. Yeah, so it was an all-day process on Mondays. So when I got to the facility, I would go to chemo first. I would tell them I'm here, and they would take my vitals and all of that, and then I would go downstairs, get radiation, come back up, and receive the chemo. And that was like all day from maybe 9 to about 3 o'clock in the afternoon, because
Ooh.
each bag was an hour or so. And then they give you the first 2 bags, and then they give you a needle, well, not manual, they manually insert a needle into the IV. It's supposed to be, I think it's called the steroids, and it was something else. I can't think of what it was. But one of them, I called it a hot shot because it would go in hot. So they would have to go slowly, and it would feel like fire going into your vein. That's how I felt. And then not only that, one of them would make you feel hot from your rectum to your vagina. You
This
will feel this.
chemo or the radiation you're talking
I'm
about?
talking about chemo.
Wow.
It's a part of the, the process. And I cannot think of the two names that it was, but it was manually inserted into the IV. And they would have to take their time because it would feel so hot, you know, going in your vein, and then the one shot would give you such a sensation, a hot sensation from your rectum to your vagina. It would last maybe about 30 seconds, but the intensity of the feeling made it feel like it was longer than that, but it wasn't.
Sounds horrible.
And it felt horrible. Yeah, it felt.
And the chemotherapy would happen after the radiation.
Right. Every Monday. Every
I can't
Monday.
imagine that day.
Yeah, it was a long, very long day because it took an hour for each bag that they gave you. So sometimes you get two bags at once, but it would still take an hour of nothing but fluids. It was nothing but fluids in bags, these big IV bags. It was nothing but fluids. And so then it made me have to urinate a lot because they're giving you all of this fluid in your body. So it made me urinate a lot. I would go in to release my bladder. And by the time I washed my hands, sometimes I would have to go again because that's how much, and how fast it was, coming through. And that's the way it was for me the whole entire time until it was time for me to leave the chemo session. So it was,
And this went on for 7 to 8 weeks.
yes, it did. But there was a period from the radiation that my skin was so bad. I showed you the pictures how bad my skin was, that they gave me a week and a half off from the radiation, and chemo as well. I didn't have to go to either or. So my body can try and rejuvenate, my skin can try and rejuvenate because it was just burned bad. And I still have the scars. I still have the pinkness on the inside of my thigh from the burns. I'm not sure if that'll come back. I was told that my skin should come back in about 6 months, but we'll see. It just still looks. But I didn't experience hair loss at all. The only hair loss was my pubic hair. Mentally cope by saying, God, I need your strength because I can't do this on my own. I need your strength to get me through this day. I need your strength. Give me the grace. I need it all because I can't do it. There were those days that I did have. And then there were other days I was just perfectly okay with it. And I just had to call on a power that was greater than me to give me the strength that I needed to get through, because even though it was challenging, it was doable. But it's just because I was stuck at home, in the house, in the bed, because at a certain point, my skin was so bad and I developed lesions that I could not sit up, nor could I sit with my legs closed. So I had to lay in the bed, and I purchased a pillow so my feet can hang over and so my legs would be open while I laid and watched TV or just laid around on my phone or whatever I was doing. But I stayed constantly in that position. I wouldn't say I was depressed. I would say I would start to feel lonely because I felt like everybody life was passing by and they're doing everything that they wanted to do, but I couldn't. I was stuck, and I wanted to get out and be out and about and enjoy life, but I felt like I was just existing and not living at that particular time. And that was when I would just continuously call on God to get me through this situation. this process. But because I know on the end of the process, on the other side, there's healing and restoration. But while you're going through it, you can't see that. You can't see it because I'm seeing my burned skin all the time, and I'm constantly taking a picture of it every 2 or 3 days, and nothing looked like it was changing at that particular time. It just looked like it was just still the same with the burned skin and the lesions. So it was challenging mentally because I just felt like I was lonely. Even though there were people, calling and checking up on me, I was still going through this by myself. I was the only one out of my circle of family and friends and coworkers that was in the house and pretty much in the bedridden almost to a point. Yes, I had people cook food for me. They went to the market. They did my shopping for me. They will call, text, you know. So I had that support of family and friends and coworkers, checking on me, making sure I'm okay. Do you need anything? Let me know. Do you need anything? And if I did, I would say, yes, I do need something. I need this. Can you do this? Can you pick up my medicine for me? If you're going out, can you pick up some fruits for me? Anything like that. I need food. Give me something I can just quick, make real quick. So those things were done for me, and I couldn't have done it without them. And I also had a buddy that Jefferson assigned to me, a lady named Wendy, who experienced the same type of cancer that I experienced. And it was great because I can tell her my symptoms, and she was like, yes. And she said she had to sleep in her bed with one foot on the floor and one foot in the bed because of the pain of putting your legs together, you know. And she would get out of the bed and go lay on the couch, but it was still, you had to be in a laying position. You couldn't sit up right. So to be able to talk about how our bodies change and the discomfort that we experience, it was good to know that someone can hold my hand through this process and that I wouldn't be led blindly through the process of not really knowing what to expect. And some things that she experienced, I didn't, and some of the things that I'm experiencing, and she did not. So, there were similarities, but yet there were some differences. I used, my sick time, and then I used a vacation week, but then I also had AFLAC. I had AFLAC, and AFLAC will give you one lump sum. Back in the day, they used to pay you every week, but now you just send all your information in, and according to your date out and your date return, they'll just send you one lump sum of payment. And then on top of that, I also had an insurance with the railroad because I'm a railroad employee. So I had to fill that out, that paperwork out. But that's something you have to fill out every 2 weeks. With that, you get paid every 2 weeks. So I was okay financially. And I'm glad that, I did have those things in place for me to be able to use.
People may be surprised that you're willing to talk about it, that you're willing to talk about whether or not you were menopausal or whether or not you were sexually active or what you thought it could have been. What makes you so willing to discuss this?
Because like I went through it and my buddy went through it. There's someone else out there that will go through the same thing. Maybe not exactly the same way, but there will be someone that will be diagnosed with vulvar cancer. And if I can get my story out to let them know it's challenging, but it's doable.
Mm-hmm.
If I can help them in any way, ask them any questions that they may have, if they were, needed me at 1 in the morning because they're feeling lonely, or they're just feeling kind of depressed, or they just needed someone to talk to, or they just wanted just to reach out because of any issue that they may be having, I want to be able to be that person to help them. Like someone helped me, I want to pay it back to someone in need. Or maybe there may be someone who might not have a great support system. I can be a support system to someone. And we should not be ashamed of our bodies
Mm.
because it is what it is. There are bodies, and there should be no shame whatsoever when something goes wrong. And also, I would just want to say if there's anything wrong with your body, just go get it checked out.
Mm.
Just go to the doctors and get it checked out.
For that woman, like many that don't pay attention down there, do you have anything to say to those women?
Pay attention. That's right. Pay attention to everything, every inch of your body, and especially in that area as well, because it's so sensitive in that area. So if you feel something that feels like a pimple and it's not going away, go to the doctors. If and don't
And
be like me trying to diagnose yourself because there's not an MD behind my name, but I diagnosed myself as saying, "Oh, you got Bartholone cyst," and coming to find out that wasn't the case. Yeah, things do happen, and once they happen, we have to be able to deal with it mentally and emotionally and spiritually. We have to be able to deal with it. Everything that needs to be spoken to someone who's going through any type of sickness and disease, it needs to be all positivity.
positive.
Speak life. You have to speak life into people because words have power.
Yes.
And so I'm just grateful that I had a great support system. I'm grateful that my faith is in God. And as I was going through this, you kept coming into my thought process, into my spirit, because I know you had a platform to reach women. And I know you talked about women's health. And I said, I'm going to give Dr. Rahman a call.
You look wonderful.
Thank you. I feel wonderful.
In your mind, is this over? Are you healed?
I'm healed. I'm healed mentally and emotionally. But physically, I'm not completely healed because my labia fused together. So that has to be separated.
Mhm.
And I still have to get a PET scan to see if I need a reset. And that will cause the plastic surgeon to come in and rebuild the left side where the tumor was to fill that hole if need so. And I developed a side effect from chemo and radiation, peripheral neuropathy, and I'm going through that with a slight pain in my hip and numbness all the way down to my leg. And some days is okay, is then some days I'm like, let me take some pain medication because sometimes the pain in the hip gets that bad. But it's part of the process. And that's like I got through one part of the process. This is a second part of the process that I'm going through. And I know I'm going to get through that. And I'm not going to look like I've been through the fire
Mhm.
when you have your faith, you
Mhm.
know. And we have to speak life into ourselves as well. It's a song called Encourage Yourself. We have to encourage ourselves as well to know that once we get through this, we can talk about it and say how we got through it, not just that I got through it, but how I managed to get through it. And
Right.
that will help other people.
So, what I find so powerful about your story is that you are healing. You don't have to be 100%
Mm-hmm.
to be grateful. You don't have to be 100% before you share your story. There is strength
Mm-hmm.
in being willing to be vulnerable
Yes. Yes, it is.
and being willing to say, this is what it is.
Yes.
And so I thank you for being willing to do that because clearly some might think, oh, that's too personal,
Mhm.
that's too private an area to have on broadcast, but it's part of our bodies. And as women, we need to um, understand our bodies. We need to take care of our bodies. So thank you, and thank you again.
Even though this type of cancer is not on the forefront, like breast cancer is on the
Mhm.
forefront. There's tons of commercials, tons of cancer groups for breast cancer. Don't let this type of cancer hold you back from sharing your story. And so, if I can put myself out there to help somebody, then that's what I want to do.